Everyone. I welcome you all to this new series that is starting today, the Materia Medica Marathon, Junior Marathon. We call it as a Junior Marathon, where I will be inviting all my juniors, all my friends to come and do a co-reading session, to do a rapid reading. The homeopath from Palghar Medical College, from Palghar Homeopathic Medical College, MLD, and reverse.
हेलो गुड इवनिंग अभिषेक
हेलो,
भाई.
गुड इवनिंग. कैसे हो भाई?
एकदम फाइन, फैंटास्टिक, डूइंग वेल.
Yes. I would just like to apologize everybody for not being able to do this last Friday. There was something very unfortunate which came to me, and we had to postpone this. But I'm really excited about this whole series, and I wanted to start this with none other than my very dear friend Vansh, and we have a long list of people who have enrolled, who have messaged me that they want to do this online reading session, and we will be doing once in every 15 days. And also there are some new other clinical marathon series coming up very soon. So I would like to welcome you once, and thank you so much for
थैंक यू.
accepting my invitation. As usual, you never say no.
थैंक यू सो मच अभिषेक भाई. In fact, choosing this book, 50 Reasons by Burnett, was it's one of my most favorite books, and it's a very motivating one.
Hmm.
As we'll go through this book, there is a story that we'll be discussing about it.
Yes,
Many
yes, yes.
times it happens, certain books, certain literature are available, they are not available in market, but it is one
Hmm.
of those books that will always give you a boost. It will always give you some optimism about homeopathy when you will feel low, with patience,
Yes,
with practice, with so many reasons. So yeah.
true.
So
So this is that one book which can always bring a lot of positivity to you.
exactly.
Okay, so this in this book we have basically this book. So you start once to start कर तू थोड़ा बता इंट्रोडक्शन में क्या है,
चलेगा.
और फिर उसके बाद थोड़ा सा मैं शुरू करता हूँ, and then we'll do one reason one by one. Because basically there are 50
Great.
reasons, there 50
Yeah.
points that are mentioned in this book. We'll do one by one, but first you give me the introduction in short, because 50 reasons है, अपने को बहुत टाइम लगने वाला है.
फटाफट
पर
करना है.
तू एकदम
Right.
शॉर्ट में मेरे को बता, और उसमें जो मेरे को ऐड करना है मैं बाद में लास्ट में ऐड करता हूँ, बट तू इंट्रोडक्शन थोड़ा सा
Sure.
बता.
Sure. So, about this book, this story dates back to year 1888, where Dr. Burnett was invited to family meet or a social gathering, wherein he met his old friend who had invited him. The purpose of this old friend was his nephew had recently graduated from a allopathic surgery school, and this friend of Burnett wanted his nephew to turn into homeopathy, because in those times and those durations, homeopathy was on a big boom, and there are a lot of physicians who were turning towards homeopathy. So this simply happened that Dr. Burnett was introduced to his nephew of his friend, जिनको उन्होंने abbreviate करके जैसे दिया डॉक्टर TAK. We don't
TAK.
know his full name. Yeah,
या.
we don't know his full name. And they had a slight kind of argument over there, ki what homeopathy is, and you people are just mere quacks and all these things. And Dr. Burnett, being a very staunch and
Staunch.
a very dedicated person in the field, he was like, ki, okay, there has to be some reason if you are saying these things to me. So I'll give you 50 reasons
Hmm.
that why I am a homeopath and why homeopathy should be there in the mainstream. And just in the fluke he said कि मैं तेको 50 reason बताता हूँ क्यों नहीं हो
हाँ
सकता
हाँ
वगैरह,
हाँ
something like that.
हाँ हाँ हाँ.
And after that there were exchange of letters between this Dr. TAK Tak and Dr. Burnett,
Yes.
wherein they strongly defend their own points कि है ना, why
Hmm.
allopathy is superior, why homeopathy has
Hmm.
nothing to do with cures and lot of things. And mind my words, kabhi hum ye introduction will put it for the readers later on. Such strong use of language and
Hmm.
conviction was
Hmm.
there in Burnett's own writings also.
Yes.
And yeah, so we'll
So
take
in
up the first
both the
reason. The
sides,
first,
yeah. So both the sides they
yeah,
wanted to defend they and like so very sophisticated British people. So so with this party when you read they will you will come to it's an almond and wine party. So it's a
yeah, yeah,
almond and wine party where they are discussing and they try to run each other down basically. So Burnett being Burnett, he said, I give me one reason why you are into this pathy and I'll give you 50
yeah,
reasons. You can't even give me
yeah.
one reason why you should do this, but I can give you
Hmm,
50 reasons. And the whole
hmm,
introduction is all about exchange of letters. So basically, the whole
yeah,
introduction is there are set of letters which they wrote to each other. There is a whole
exactly.
conversation, which is a very
Hmm,
interesting conversation. I think the whole part may be very easily summarized by both of us. But
yeah,
those who are listening to this should go and read this introduction. It's a very strong introduction, right? Like rightly Vansh has said कि इससे पता चलेगा कि तुम लोग को खुद के लिए कैसे कैसे खड़े रह के लड़ना चाहिए मतलब किसी से डरने का जरूरत
exactly,
नहीं है कोई हम किसी गुलाम
exactly,
नहीं है हम किसी से अच्छे ही हैं ऑल द मोर बेटर ही हैं ओके सो
exactly.
फर्स्ट सो ऑल दीज 50 रीजंस दैट ही गिव्स आर 50 केसेस दैट्स व्हाट आई फील कि ये
Right.
50
Hmm,
अपॉर्चुनिटीज हैं where he
hmm,
could bring out which where he could show that homeopathy shines much brighter than any other contemporaries. So 50
yeah.
reasons will be 50 cases. So first case,
Cases. Okay. But the
once.
first case is about Dr. Burnett when he was working in a surgery department as a resident doctor. And at every change of weather, he had this thing coming up that there were a lot of small children, small kids getting admitted in the hospital. And many of them used to die of pleurisy, of influenza, of fevers, right? And there were a lot of trial and error with the allopathic part of medicine also. So he shares a small story about there was a small kid called Georgie. He was admitted in the hospital and he had some cold exposure, after which he caught cold, he got into pleurisy. There was a lot of respiratory distress and everything. And which they labeled at that time as fabricula,
Mm,
which dropsy, which later on followed with pleurisy. And unfortunately, after trying good number of medicines, this small kid died next morning. So this hurted, and he was emotional about this thing that this small kid should have survived. He should not have
mm,
passed away like this, right? And from the Royal Infirmary, where this hospital was there was a medical friend of Dr. Burnett who persuaded him to study homeopathy
mm,
and try to apply it if he can, and then later on decide if he can do it or not.
mm,
So, tired of all the medical methods back then, Burnett thought, "Ki, okay, let's give it a try."
mm,
So he was advised by his friend. He bought Hughes Pharmacodynamics and
mm,
Hughes Therapeutics, wherein he advises this Dr. Tak to read the introduction part from both of these books. And over there, he starts with his first case. He also mentioned that over a period of time, he tried to master this works of Dr. Hughes from his pharmacodynamics, and he gives a lot of introduction. There is a whole of the thoughts truth. Either it is truth or either there is whole lie in homeopathy. So just to
mm,
explore, it is just the truth or the new way of treatment, or it is just a fake thing. I'll have to read everything. And Dr. Burnett was a kind of person who used to not merely believe on what someone has said. He used to read and then apply and then make a opinion of himself. Okay, this thing has worked like this, and he was not a person who would merely just believe on someone. So after reading through the book, same thing happened one day. In a one evening, a lot of small kids came. They got admitted in the hospital, and somewhere in the book he had read that simple fever gets very well better with aconite. He read in Hughes. So he had a whole set of small children. He ordered the nurse to get the tincture of the aconite and prepare it in a whole bottle. And to one side of the room where the kids were admitted, he said them, you give them the doses of this aconite, and what a regular treatment goes on, you give to this set of children who are, on the other side of the room. And the whole set of children who were suffering from this feverish cold, common cold, and if you had developed rheumatism, gastric complaints, measles, all of these things have happened. So this Fleming's tincture of aconite, which he had from his surgery department, he ordered them to give it. So in the next morning, when Dr. Burnett came and he was just on the round, and he was quite surprised. The kids who had got this mother tincture of aconite on the other side of the room, they're actually up in the bed, they're playing, they're looking, comparatively healthy as compared to the previous evening. So he writes, I found nearly all the youngsters on the aconite side feverless and mostly at their play in the beds. But the one who had measles and had been sent to the proper ward later on for the proper treatment, I found aconite did not cure measles, and others remained for a day or two and then they were discharged. And on the other hand, most of the kids who were on the other side of the room, they had some localized inflammation, some had catarrhal complaint, and some fever got worse, and they had to move to some other department for the further treatment. So here he concludes that aconite, when given at the right time, at the convalescent in within 24 to 48 hours, it will cure the cases at the prodrome stage of a simple fever. And he also mentions when there is a rheumatic fever which once gets, then aconite proves to be helpless.
Hmm.
So he concludes this first reason for being a homeopath, where at the end he again remembers that small kid Georgie. If he would have also had this medicine, he would have been stayed alive.
Ha.
This was the first reason.
Ha. Just last part, because it is a very interesting. I'll just add it that it
Mhm.
is written that he was on a leave from Friday to Tuesday, and the nurse who
Ah,
had this
I missed
tincture
it.
of he has
Ah,
she labels this as Dr. Burnett's fever medicine,
yeah.
and she was very upset that Dr. Burnett is doing this experiment of giving them to few and not giving them to other. So when Dr. Burnett is
Ah,
on leave, she gives it to everybody. All the kids improve. When he
everyone.
comes back on a Tuesday, he says most of the kids were discharged. And he says, what happened? He
Yeah.
said, I gave it to everybody and I could not see you that you were being so harsh to these kids and you were not treating them equally. So this is
Yeah.
how the first
Yeah.
reason. And this case of little Georgie, even this is given because this is this little Georgie, no, is a game changer. That episode is a game changer for Burnett himself. So even in the best of
Yeah.
Burnett, this whole episode is mentioned with lot of elaboration. So this was about the
Yeah.
first case. Second case is very short that he himself mentions about his own case that there was a pleurisy which he had suffered in past, and this left-sided
Mm-hmm.
dullness in the chest which did not go at all, which he took then
Mm-hmm.
bryonia and then he felt much better. So this is the reason
Okay.
number two. Now reason number three.
Okay. The third reason, where he mentions that Bryonia helped him because Bryonia has affection for the serous membranes.
Yes.
He goes further elaborating another case of a pleuritis rheumatica,
Yeah.
wherein a city merchant who went for some political meeting, he got some chill in the evening, and by the next day, he had pleurisy and joint pains at the same time within a short duration of time. And he was advised by some of his family members not to have homeopathy, and all of these things was happening. But his wife was sure that homeopathy would help him, so he was approached, and the patient himself, he flatly refused to take homeopathy. But as her wife insisted, so he got the symptoms that there was raging fever, there was a lot of pain, and this patient was constantly saying, "Doctor, please give me some relief from this pain." So unbearable pain he was having, and I at least want to procure some kind of sleep, that I cannot even sleep at night with this fever and everything.
Hmm.
So he gave aconite and bryonia, and there was no much pain on the next visit.
Hmm.
And on the next day, yeah, on the next day, uh, he visited him, and his some other friend, some other colleague in the other part of city was also having some similar kind of condition.
Hmm.
And Dr. Burnett said him, you continue this medicine for few days. By the time you will reach the office, you will still find your colleague ill in his home in his bed. And the
Hmm.
similar thing happened when this patient recovered. He went back to work. The other colleague couldn't come back. So
Hmm.
he showed how superior homeopathy was there when his sleep and everything was disturbed from this very bad pain, and this was the third reason.
Hmm. So reason number four is a case of a man again with a pleurisy, and he
Mhm,
was such an old patient that he used to. There was a physician of those that time who had done a lot of work on auscultation and percussion of chest, which is called a Skoda. So that Skoda's
yeah.
lecture, he was so much interested that in these like about his own illnesses that he used to attend lectures of Skoda, and then
Mhm,
somebody had referred him to because this untreated uh, pleurisy ultimately came to him, and then he says he treats with Bryonia alba, which was followed by Chelidonium, but rightly
mhm,
in between he says that there has to be a use of sulfur.
mhm.
Okay, so this is about case number four. Reason number
Yeah,
five.
yeah. Now reason number five. Here he mentions the same thing about the use of aconite in common fevers, where which can act as a preventive medicine before there is inflammatory localizing of the illness. And secondly, for bryonia, same thing he mentions that where there is serous membrane affections, bryonia should be something that can be thought of. And going ahead, he mentions that uh, it's not about just healing the disease, but
Hmm,
it's from a proud position from being a homeopath. He writes
hmm,
this to Dr. Tak,
hmm.
and it is more of a healing art rather than just, you know. And he says, next case of chloral hydrate in lethargic somnolency. Now, if you have to understand this, there were times where people used to have hypnotic medicines and medicines which were used to treat this excessive sleepiness. Excessive sleepiness, or I'm missing
Sleeplessness.
something over here. I'll add to it. I'll add to it. Uh,
Sleepiness. बरोबर है, बरोबर है.
as a sedative, as a sedative. Yeah.
Sedative.
So he mentions of a case wherein due to chronic pluralism, where
Hmm,
the people have this habit of popping pills made of this chloral hydrate and make it a habit. So they suffer from this chronic condition, which later on causes fatty degeneration of the internal organs and also of the CNS. So he narrates the case of a 45-year-old lady who
hmm,
had this complaint of lethargy and sleepiness all the time,
hmm,
lacking energy, lot of weakness. And this lady used to be listless, having no interest in anything
hmm,
throughout the day. And even while dressing, she used to have someone to support her and make her sit, and all those things. There is so much of lethargy.
hmm,
So Dr. Burnett started this patient with low dilution of chloral, homeopathic preparation of the same chloral hydrate, which cured his patient. And he mentions at end that this patient later on became brisk, active, and she was used to be wide awake.
hmm,
And there is a second case of the same condition, wherein the patient had lethargy, languor, somnolence, wherein he gave 2x preparation of chloral hydrate
hmm,
uh, every early. And he mentions the date as well. 21st April, he gave him the medicine, and
हाँ,
on 7th May, the patient
hmm,
is less lethargic. He has improved a lot, and there is less of languor. And
hmm,
the third trituration later on he gave,
hmm,
and he was informed that the patient subsequently improved after that. So later on, he gives a very small comment about this, that this doesn't fit into any kind of nosological cadre or any diagnostic condition where the patient says there is so much of sleepiness. Maybe at that time there was no specific diagnostic term, but
mm,
it's a therapeutic independence which allows a homeopathic doctor to
mm,
treat according to the symptoms what are available.
mm,
That is a small note which he mentions.
mm,
And this law guides in the darkest of diseases
mm.
of this in my more of a next reason he'll mention. So
Next
up to you.
reason, in the next reason again is a case to where he says you have to see the curative power of Kandirango, which was at that time being introduced into homeopathy and was being
Mm-hmm,
used successfully in cancer. He said the cracks in
mm-hmm,
the mouth, which we see the commissure of the and commissure of the mouth, where you see there is cracks, and he
mm-hmm,
mentions a case of cancer of the left breast in the middle-aged lady,
mm-hmm,
where there were deep cracks at the angle,
mm-hmm.
and he used Kandirango, which slowly and steadily uh, set up a perfect cure.
Hmm. That is about Kondurango.
Yeah,
Okay.
that is about Kandirango. Then we have number seven.
Number seven. Number seven, he mentions about the utility of homeopathic preparation of Vanadium metallicum.
Hmm.
He also mentions that those times there was nothing of Vanadium metallicum prepared in any form in allopathy as friends on homeopathic got it about that it is something can be used in cases of atheroma of the arteries where there is
Hmm.
fatty degeneration.
Hmm.
Okay, and there are cases wherein he has used phosphorus and tim rs and with not much satisfaction,
Hmm.
where while vanadium gave him really good cures. So he mentions that nothing satisfies me but a cure, and he studied this physiological action of vanadium
Hmm.
from the physiological effects from the proceedings of the Royal Society of Medicine.
Hmm.
Okay, so on the structural changes it produces in liver under the influence and salts of vanadium is a true cell destruction, he mentions. And
Hmm.
the pigment escaping from the liver later on causing pigmentation at liver various parts in the body.
Hmm.
Uh, and again, it causes atheromatous conditions of the various arteries. So going further into the case, there is this very old lady who, some 70-year-old lady,
Hmm.
uh, who had this complaint of this, yeah, atheromatous condition, and he chose some ammonium salt of vanadium according to the homeopathy. And later on this lady was not seen. After a few years he met this lady somewhere and she was doing very hale and hearty. She was doing quite well for her health,
Huh.
wherein he mentions that he never even now he was on any other kind of medicine except for myself.
Hmm.
And time and again he taunts this Dr. Tak, wherein in the letter he had mentioned that we regular physicians do so much for society and everything. So he taunts him back that you regular are the one who not far have gotten into your dignity to quest the remedy for
Hmm.
case. And over here, humbly and hopefully, we are doing this scene with the Hahnemannian law, wherein he
Hmm.
just mentions that you doctors do so much for the society that you mentioned, but over here you have to test a medicine or see if the disease is curable. You will not even take a step, something like that.
Hmm.
So yeah, vanadium was
Okay.
certain form of fatty decay. Reason he mentions. Now the reason.
Okay, so now we have reason number eight. Reason number eight is it mentions a case of a lady with having a very gnawing pain in the left side of the rib,
Hmm.
when in a splenic region, which was aggravated in the night, warm and by the bed, and was aggravated by the warmth of the bed. And there was a concomitant
Hmm.
which said there is left eye lacrimation, which becomes very red. And then he says he
Hmm.
used Juglins regia in 30C potency,
Hmm.
which really helped
Hmm.
him a lot. And
Right.
then again in the end here, again you see the law of similar gives executive potentiality to the one's knowledge of the drug physiology and more or affords to my eighth reason and not being a regular. He mentions that I'm not a regular. So this is what he
Yeah.
taunts him back again. So now we
Yeah.
have reason number nine.
Yeah. In the ninth reason, this same conversation continues where he mentions that this jeering offensiveness in the tone, it may remind you that my regular friend, he calls him that you are a regular friend who
हाँ.
practices like that. And about his uncle who bought him ki you should make him a homeopath. So all this argument continues further.
Hmm.
And he says mighty height upon the homeopaths that how you, uh, you know, most unspeakable content,
Hmm.
content your ignorance that you don't want to see what a regular can do something apart from what they are doing just because you
Hmm.
are an ignorant person to the art of healing. So
Hmm.
he gives him back, and he reminds about this case of Juglans regia,
Hmm.
wherein he had another case where the patient had pain in the left hypochondrium this time, where Juglans regia was given, and
Hmm.
after 5 weeks, this patient again complained of a similar thing on the right side this time. He had the pain of the right lung also. So he gave chelidonium mages in 5 drops,
Hmm.
and it cured typically in just a fortnight. He had to discuss the reason why Jordan's was one, wherein he mentions and the chilidonium on the other side. On my account of my okay. Jordan's is a pain in the left side and chilidonium on the right. This was reason number 9. Outside and
तेरे वंश तेरा नेटवर्क थोड़ा सा जा रहा है.
okay. Switch network. एक मिनट ठीक है. Is it okay now?
हाँ, अभी आया हम लोग.
If the minimum is making me
हाँ.
okay. ना
क्या?
मैं अगर मिनिमाइज कर रहा हूँ तो वो लाइव छोड़ने के लिए बोल रहा है.
नहीं नहीं, तू मिनिमाइज कर ही मत.
ओके ओके
हाँ.
ठीक है.
सो
कुछ
नाउ
ऐसा
वी.
डाउट आता है तो प्लीज बोलो.
हाँ, वंश भाई का ऑडियो वीडियो लैग हो रहा है. ठीक है.
ओके.
ठीक है. ठीक है. तो now we go to the reason number 10. There was this lady with chronic cough lasting for about half an hour to 4 days, and she has emanation of menses, leukorrhea, thirst, and saliva in the mouth. Hiccups was reflected from uterus. Now this is what he. Huh. So hiccups were taken from the reflex coming from the uterus, and this is what he tried to interpret and gave Thuja, which did not respond well. And then he followed it up with sepia because that time the patient started complaining with leukorrhea, which again did not help. And then the further evaluation, there were new set of symptoms, which he said now she has thirsty, tongue coated, nausea, mouth filled with fluid, like headache, weakness, fatigue in her limbs. And on the thorough totality, they found it that cyclamen 30 cured the case.
Going ahead to reason number 11.
11, yes.
Yeah, here he mentions a case of a very bad hiccup which was treated with nitramur. So, clergyman's wife, about 50 years of age, came to Burnett with this complaint of very severe dyspepsia and acidity complaints, for which nitramur was prescribed, and she got better. And so, Natramur sixth trituration was given, where he mentions that uh, hiccup occurring in the morning, in the noon, and at night for at least 10 years. And this had happened after the patient consumed quinine. So, mind well, quinine earlier was very haphazardly used for any kind of fever or any malarial fever in whatever kind of doses, and it had such a long term of bad effects that he had to mention. Hiccup lasting for 10 years. Okay. And the hiccup was so bad that it shook body में ऐसे shock आता था, severe kind of hiccup up to 10 minutes, and it was very distressing for this patient. And at 3 separate times, this patient had consumed quinine for her some complaints of tics she was having on her side of face. On the first and second time, this complaint got resolved, but on the third time that she had to consume quinine, she ended up with this complaint of acidity and this hiccup which lasted for almost 10 years.
Hmm.
So after after which Natramore cured this patient. Then Burnett came up with 4 conclusions what he learned from this case. It was he also gives the reference. He refers to T.F. Allen's encyclopedia from symptom 370 and 379, where he mentions about the Hahnemann's doctrine of drug dynamization, where this after quinine, this hiccup can get cured is mentioned under Natramore in T.F. Allen. So he concludes further that quinine, if given for ticks, can have long-lasting bad effects, even
वंश
lasting
वापस
even for
लैग हो
10
रहा
years.
है, वंश वापस लैग हो रहा है. कोई और अगर वाईफाई यूज कर रहा है ना तो बोल दो सबको डोंट यूज वाईफाई. इफ
वही
देयर
बोला.
इज अ कॉमन वाईफाई ना.
Is it fine now?
हाँ हाँ, वो बीच बीच में फिर थोड़ा
बोला है.
लैग कर जाता है. हाँ बोल दो. ठीक है
Sure,
ठीक है,
sure.
कंटिन्यू कंटिन्यू.
So the second reason he said was Natamur 6x antidotes the effects of quinine. So try to understand how he correlates the things where he finds out the cause effect relationship he looks for. Okay, it antidotes quinine. The third thing, the crude substance that you consume daily, Natramore salt you consume every day, but it has no medicinal effect on you unless and until it's dynamized. So he mentions that the Hahnemann's drug dynamization is not a mere myth or just a theory, but it's the truth, and it brings out the strength in the crude substance become medicinal. The drug preparation is not merely a dilution or attenuation, means saturation, but the power resolving or power producing properties. It's a process that true potentization and dynamization brings out the medicinal value in the substances. So this was
Okay.
his conclusion
Yeah. So
from his reason number 11. Yeah.
the reason number 12 is again a case of a 10-year-old female, which was
Mm-hmm.
brought by mom again with a case with complaints of hiccup, suffered from
Mm-hmm.
bloodlessness, languor, bilious sore throat, nausea, fainting, frontal headache, poor memory, sore breath, and
Mm-hmm.
rising in throat. So
Mm-hmm.
stools were white and scanty. Then there was
Mm-hmm.
pain in the left side, going aggravation going uphill. Then associated complaint, endocardial brew and enlarged
Mm-hmm.
spleen were the main complaints, and which the
Mm-hmm.
patient on further examination he mentions there was past history of varicella, measles, and once this
Mm-hmm.
patient was vaccinated, and again when we will go through the Burnett's vaccinosis, we will maybe elaborate this more. He says that
Yeah.
he mentions because there was once vaccinated, he gives Thuja 30 in infrequent doses, and which cured everything.
Yeah.
ठीक है now reason number
Yeah.
13.
Reason number 13. Yeah. He again recalls this mortal malady which about the hiccup case, and he later on goes further that how homeopathy can cure pleasantly, safely, without causing no much trouble to the patient. And I can ask for no other system of medicine which can be so pleasant. So he gives a case of aphonia, which was cured by arnica. A well-known singer who had came to him for aphonia of the throat, and it had taken a follicular and congested form. And this he considered that for a good deal of arnica in such a case, from ill effects of bruises, hurts, sprains, or trauma in general, it can be used. And he goes further. After using various remedies, in that aphonia case, he didn't got much result. So he considered, he being a singer, the patient being a singer, he mentioned this overstrained state of this vocal cord might have
Hmm.
caused this aphonia. And
Hmm.
then arnica was prescribed, where he
Hmm.
mentions physiological action symptoms similar to the condition. That's why he gave arnica. And
Hmm.
he again says further that you will once for all disabuse your mind for the very vulgar professional or popular error,
Hmm.
according to which the homeopath said it to be claimed to be cured, to be an incurable. He mentions that there are a lot of conditions wherein these regular physicians over at that time, other medical schools used to mention these. This is incurable. He says it's such a kind of vulgar professionalism that you people are following and labeling things incurable. I mean, you would even give her a try.
वंश वंश एक काम कर,
हाँ.
तू
हम्म.
ये लीव कर, मैं तब तक
हम्म.
14 नंबर करता हूँ, तू वापस ज्वाइन कर, एक बार रिफ्रेश कर ले,
Sure.
रिफ्रेश कर
Yeah.
ले, तेरा नेटवर्क
ठीक है.
रिफ्रेश कर ले, क्योंकि बार बार लैग हो रहा है ना। ठीक है।
Yeah. मैंने चेंज किया है नेटवर्क.
अच्छा ठीक है। So we'll go to the
Yeah.
reason number
Done.
14 that it mentions as a case of erysipelas of face at odd intervals where arnica again was given in high dilutions, infrequent doses cured. Arnica also cures,
Mm-hmm.
this is what he mentions, that arnica also cures erysipelas.
Right.
Again with a long description, but in short, if we had to say that it is a case of erysipelas at odd intervals coming cured with arnica in high potency.
Right.
Let's go to reason number 15.
Yeah. Reason number 15. So he had a very severe case of Quincy, where he had used various remedies, but he failed. And this patient was in very great distress. And almost 12 hours, he was unable to even swallow even few drops of water. That was such bad was the state. So not even grape juice or some operative inference was needed at that point of time. Then Burnett was approached, and he gave a centesimal trituration of a remedy. Okay, and that medicine was Baratakab.
Baraitaka.
Yeah, carbonate of barium. In a
Hmm.
dozen of hours, the patient ate a whole basin of bread and milk, whole big quantity of bread and milk, and he says often it has cured Quincy's before also, but this Barataka, and he has done this a thousand of times with many number of other patients. It's not a clinical tip of mine, but it is a 15th reason for being a homeopath. So he mentions every time it's not just a mere fluke or a coincidence, but
Hmm.
for hundreds of times I've used the same medicine in this condition, it has cured, and again it has cured.
Hmm.
Yeah. Next reason.
Okay. Okay. So case number 16, we see it's a case of a 40-year-old seaman, or let's make it as a sailor who comes
Mhm.
with fever with shivering, which is 2 to 3 times a day with watery vomiting. So on
Mhm.
21st April, for 3 weeks, he has taken some tonics, which he feels is cured. Then when he comes back to the port, during the first 3 months of voyage, there was 2, 3, 4, and 5 attacks per week. So the captain of the ship must have read something and has given cinchona bark, and the fever then gets subsided. Later on, in the then the patient start complaining of right-sided pain in the ribs, and which he cannot lie down on the right side. Both side calf muscles are very painful and sensitive to touch, hard and stiff. And then again, le- uh, left leg was semi-flexed condition. Left leg was in semi-flexed condition, and he was in the sea when he was in this condition. Urine was muddy and red. Bowel was regular. Skin was tawny, and conjunctiva yellow. Habits: having 3 liters of beer daily, which causes hiccups. Now, this case, he says, there is suppression caused by cinchona, and there is excessive
Mhm.
uh, coldness of the body. And to create that heat in the body, he says, I am giving natramur 6x potency to generate the heat and to counter the cinchona, the chill that is induced, the coldness that is induced by the cinchona. Then he gives 6 grains in water every 4 hours, and thus the cure was uh, achieved. And then he says the pain on April 27th, he writes, there is pain in leg entirely went but returned on the fourth day. And then he again continues the same medicine. Then on 4th May, this patient comes for the follow-up, almost well, little bit of calf pain left. And he says there is excessive perspiration every night since he got fever. He continues the same medicine. Patient is doing quite well. And there, here he writes, profound use of salt, that is natramune, generating heat and curing back the patient.
Yeah.
Okay, so now let's go to point
Yeah.
number 17.
Yeah. Many times in the practice also We have so
Yeah.
many patients who are being abused with HCQS for so
Yes.
many reasons. And many
Yeah.
times you have to start certain cases with Netamur.
Yes. Netramure.
Yeah. Then case number 17, uh, Burnett had to see a daughter of an well-known alderman of London who was suffering from a lot of fearful neuralgia of the face for so many years. And they had their family advisor as a homeopath, but he failed to uh, cure that girl. After several consultations with eminent doctors, there was no hope left. Then Burnett was approached. What he found was the pain of this facial neuralgia was worse in cold weather and was worse at seaside. We'll get many cases in the book wherein he, based on this worse at seaside, he directly comes to Nettermore.
Mm.
Then the patient used to be better. This her neuralgia was used to be settled when she was away from the sea, when she was inland, and not so frequent or so severe when she was inland. And her eyes used to water when she had pain. A pinch of sixth trituration of natrum in water 3 times a day cured this young patient, and in about 3 weeks. And he mentions about this anti-neuralgic action of natrum. This he mentions as the 17th reason. Yeah,
Yeah. So in the reason number 18, he mentions a patient who wants to consult but said it is of no use to consult you about cold shivering fits. No one could cure him. He says nobody is able to cure me. He's lying on bed in night, shivering. The teeth used to chatter. There was chattering of teeth and movement of the body shook his bed. The movement of the shivering was so strong that it used to shake his whole bed. And this he kept on suffering for a year almost. And he again says that salt can generate the heat in the body, and therefore he uses natramur again.
sure.
Okay, so let's go
Yeah.
to number 19.
Number 19, he mentions that although this natrum or sodium chloride is common salt, but he cannot believe in the sense of medicine. He has used natrum in inconsiderable number of cases. He
Hmm.
has treated with natrum cases of chilliness, swelled spleens, gout, constipation, neuralgias, and so many more. So, what is more practically important is understanding it from a homeopathic point of view. He mentions about a case about a lady who was an officer who came from India to get treated from Burnett, and it was a husband's friend who had some nearby place at the seashore of Sussex. He invited the couple, but they didn't go because her wife was suffering very badly, and it used to upset her, and it used to cause her blues, depressive states, which always used to avoid going to visit that friend. He used to invite always. So, considering that I'm obliged to decline this and this nasty lodgings by myself, and at the same board, I'm on the ship. I'm very dreadfully ill. So, in this case, also he gave Nattermore in six trituration, which modified this lady's state, and that she can stay at one place, one set place, but she enjoyed being at sea after giving this medicine Nattermore. So he mentions that the general state of the person, which cannot be labeled under a diagnostic term, that the patient feels dreadfully ill, upset, sad, depressed, also can get treated with.
Yeah.
Yeah.
So in the reason number 20, he mentions a case of a patient who
Mhm.
lived by the seaside and who had an occipital headache, aggravation, waking up in the morning, which was throbbing kind of a pain. Now, during menses, he had this during menses, he mentions that she had a frontal headache. And on further inquiry, he found that there was a left ovary, little swelled up and tender. And that is why he says that he used Thuja in high dilution, infrequent uses, which cured the case.
Yeah.
21.
So in the 21st reason, he quotes some previously accused words to him by this Dr. TAK. He mentions that in the previous letters you have mentioned that you consider your homeopathy as superior to that of your co-practitioners and all. Wherein Burnett writes back and he mentions that it's not just people's belief who have often nothing to do with the facts, but you allopaths ridicule homeopathy, but that system of medicine is true in all the same. Many practitioners of homeopathy ridicule some of the most brilliant clinical triumphs, and all these things go on, where he mentions their powers and the limitations and possibilities that you have put onto yourself. And these are the some of the people who are the greatest enemies of homeopathy, who themselves he called these homeopaths as weak-kneed and incompetent practitioners.
Hmm.
So he goes to the next case, case number 21st, menorrhagia of 15 years standing, which was cured by phosphorus. This
Hmm.
51 years old lady came for complaint of menorrhagia,
Hmm.
where she had no break in her menses,
Hmm.
while the menses still used to be regular. For the history he got that she had a miscarriage 15 years ago, after which her menses started to flood for days together. Over here, he gave phosphorus in CC potency, which cured her, and she went much smaller in the waist. She lost the fats around the waist later on after phosphorus, and she mentioned that I feel like a young girl now.
Hmm.
And she had other intercurrent remedies apart from phosphorus, which were lecasis, ferrum, thuja,
Hmm.
arnica, but it was phosphorus that cured her hemorrhage.
Hmm.
And yeah, this was it. Over here, he also mentions further that there are many practitioners who don't believe in the high dilutions, but I
Hmm.
have a lot of cases which are treated with very high dilutions. Either they have been mistaken, means the other physicians, they must have been mistaken about the potency, maybe, but they are very powerful. And such kind of patients who were on so much of gallons and gallons of syrups and drops for 15 years of bleeding never cured. It was cured with a dose of phosphorus CC.
Yeah. So now here, what he's mentioning is phosphorus CC, which is 200 potency, and he says this is high potency. And now we have a much higher potencies available.
Available.
But even the right in the next point, that is now point number 22, the reason number
Uh-huh.
22, he's mentioning that all that matters is similitude.
Mm-hmm.
That is what he says. That is really important. Is if the 200 is the simillimum, that would be the
Mm-hmm.
cure. And here he mentions a case of exostosis of the right os, which is calcaneum spur, cured by
Mm-hmm.
Hecla lava. A young lady
Mm-hmm.
with exostosis on her right calcaneum bone, which is
Mm-hmm.
painful. Thermally, she goes blue in winter and chilblains on both the hands, feet,
Mm-hmm.
and worse on hand. Now he says that there was a complex which he wanted to prescribe, and that he says that calcarea, Hecla lava was given in 6 grains 3 times a day. With
Mm-hmm.
Hecla lava, now this lava has silica, alumina, calcium, magnesium, and ferrum oxide, which fully
Yeah.
cured the patient in 2 months. Now,
Mm.
therefore, we have this when we will go to the different remedies. We will discuss this in later that how helpful a Hecla lava remedy can be. Let's go to
Right.
23.
In case number 23, he also again mentions about the use of these high potencies, which benefit much better in certain cases. So to defend that it's not a mere fluke, he mentions a case of a horse.
Hmm.
Uh, a case of horse where he had the horse had a large exostosis, where
Hmm.
the same remedy Heclala was given, and the
Hmm.
horse got cured of this
Hmm.
exostosis. So he says and mentions it's not just mere faith. Okay.
Hmm.
And he goes to next another case of a cranial exostosis, which is cured by aurum net. So he had published this case years ago in a journal where he mentioned
Hmm.
a bony growth in the skull was completely and permanently cured by metallic gold in homeopathic preparation, and none of an isolate case. But before any time during this was in the last 50 years, uh, that gold preparation can cure these exostosis which was growing inside the brain. He gives this as the 23rd reason. Yeah.
Hmm. So the reason number 24, now in the gold itself, we will, it is 10:23 p.m.
Mm-hmm.
Vamshi,
Mm-hmm.
thanks for letting
Little
us know
rush.
what the time is. So, uh, what we want, yeah. So I was mentioning Aurum Metallicum is also a separate booklet which is given that Aurum is a gold solvent. So we might come through that sometime in future. So there is one now. This point number 24 is all about mentioning about the Aurelia. There, he mentions here four cases of Aurelia racemosa, where he
Mhm,
says that ladies suffering from a cough that came after lying down at night used to stay in damp houses where
mhm,
hyoscyamus digitalis and other remedy could not cure the cough. And he then uses, because she used to lie down and begin to cough, get
mhm,
labored breathing. This was the sequence of events. So lying down, coughing, labored breathing, Aurelia racemosa. This is what he mentions. So this is
right,
case number one. Then there is one more case where he says that same cough, but didn't begin as she used to lie down instead. She used to go
mhm,
to bed, sleep. After a short sleep, wakes up, severe fit of coughing that would last for an hour. Again, he
mhm,
gives Aurelia 3x, Aurelia third potency, and it gets cured. Now, there is a
right,
child with croupy cough in damp weather,
mhm,
yield to Dulcamara, but nocturnal cough, going to bed, lying down, falling off to sleep,
mhm,
presently awake with violent cough. He gives Aurelia, which makes the patient beat better. Now there is 50-year-old male with asthmatic moderate emphysema of the lungs. At first, she has short breath on exertion, had nocturnal attack of dyspnea and cough. Now the constitutional treatment cured him, but when he catches cold, he gets early nocturnal cough causing asthma, and that lasts for 1 to 2 hours. Aurelia in
mhm.
3x, cough became more violent but then ceased and never returned. So this is about Aurelia racemosa in point number 24.
Yeah. Now, reason number 25th. He mentions about a middle-aged gentleman from London. He was a well-known person, and he was in a very bad dying state. He had a very bad aneurysm of aorta, along with he had very bad dyspepsia, for which he had gone to many medical men, many sorts of treatment for years together. He has changed so many doctors, but at the end of the day, he received iodides, preparations of cordials, antacids, tonics, but which worsened his aneurysm of the aorta. And later on, this tonics used to give him very temporary relief, but on the other hand, it used to worsen this aneurysm. And by the time this case got in hands of Dr. Burnett, he was in a very bad state, and he used a series of remedies. The principal remedies which he used were aurum met, chelidonium, cardos marinus, ceanothus, quercus glandium spiratus, aconite, ferrum met, cactus grandiflorus, barata mur, which cured this patient of aneurysm. He also mentioned that the first name medicine and the last four, which is the aurum metallicum, Baraita mur, Cactus grandiflorus, Ferrum and aconite, he mentions that these are specifically curative in such cases. He got this knowledge of using Baraita in such cases from Dr. Flint.
Hmm.
And after a few days, he mentioned he saw this gentleman walking somewhere on the street, and he got in conversation with him. And he was in a very better state. He was looking healthy. He's having a ruddy appearance, and his aneurysm complaints were gone. And yeah, and then he again taunts him further. What you had told me at your uncle's place and everything. This is not boastful of me, but he has cured this aneurysm case with series of remedies. Yeah.
So in point number 26, he continues his conversation that how he was run down, and there is a whole paragraph where he says that somebody used to taunt him that his
Mm-hmm.
auntie, that you can take homeopathic pilules as much as you want, they won't hurt
Mm-hmm.
you, and that's the whole conversation. But then he says again that I have told you that I will quote you 50 cases, and I'm quoting
Mm-hmm.
one again from my practice, where he
Mm-hmm.
mentions that where he mentions this case that 20-year-old female
Mm-hmm.
complains of fading, ill-defined, peculiar throat symptoms, weakness in her back, in
Mm-hmm.
rectal and uterine region, irritation and weakness with emaciation. The diagnosis was Bright's disease of kidney that cannot be cured. Now, homeopathy cured. She married, has children, and has very good health, and she was given Mork Vivus by Burnett. This is what he
Yeah,
mentions here. Point number 27.
27th. Yeah. Case number 27, he mentions a post-orbital neuralgia case standing for 20 years, 20 साल पुराना. This 50 years of aged person had came to him, and this patient had been under almost every oculist present in London at that time for the complaint of this neuralgia of eyes, and they couldn't find anything in the findings. So there was terrible pain at the back of the eyes. She used to be in paroxysms, and which made her confined to a room for many days together. For many days, she couldn't get out of the room, and she used to remain in a very dark room. So it was diagnosed that it was neuralgia of the fifth nerve, which was causing her this neuralgia. And there was nothing wrong structurally. Only thing was, uh, yeah, she used to literally tie her head, and she used to literally sleep in the dark, thinking that she should, this thing should take her away. This pain should kill her. This was the kind of intensity she used to suffer. And on inquiring, he understood there is a history of influenza. After the attacks of influenza, there was to be this post-orbital neuralgia, which confined her to the room. And this was a very despairful situation for the patient. A lot of agony and everything. And a lot of other homeopathy was done, which had also failed. And on inquiring, he understood this lady tells me that she had been vaccinated 5 or 6 times in the past, and she was much vaccinated. He considered this as a case of chronic vaccinosis, which localized as a neuralgia. And then Burnett prescribed her a dose of Thuja 30, and the neuralgia disappeared gradually over 6 weeks duration of time. And he refers to his case records where he mentions the date of 14th February 1882, where he mentioned the eyes are well now. And later on, there are further follow-ups, 30th December, where he mentions that Thuja cured this case of neuralgia of 20 years standing, and this lady was suffering from vaccinosis, is thus, which can be labeled. And Thuja did the cure inconvertibly, and my vaccinosis hypothesis led me to prescribe this medicine. At least the case must stand up as a clinical triumph for Thuja 30. And in the reply, he mentions that he received from the patient that I have been very much stronger and healthier ever since I crossed your threshold, and accepting one or two attempts to return of the enemy and of the sufferings. So yeah, there are several other medicines for this neuralgia complaint, but Thuja over here helped it.
He further on takes it at the point, reason number 28 also, where is a case where
Mhm,
there is where he mentions a case of chronic headache in a nine of which was there for the duration of 9 years. It's about a
mhm,
19-year-old girl who
mhm,
had a bad attacks of headache for past 9 years, frontal throbbing as if the head would burst. She was very pale, forehead looked shiny and brown. Once a headache would come once or twice a week. Tendency to constipation, menses is normal. Poor appetite, dislike to fish and meat, feet cold, and history of boils and lips cracked. On this totality, he prescribes graphite is 30.
mhm,
Appetite and spirit improves. Otherwise, there is no change. After three white-headed pustules of smallpox 10 years ago, which he finds on further follow-ups, he gives Thuja in 3x, where the patient starts feeling much better, has the intensity, he writes it's slight, there is slight headache now. Then he gives Thuja 12, one drop at bedtime, and then he writes that headaches have never returned. This
mhm.
was about 29. Now it is 29.
Yeah, 29th reason is case of enlarged cervical glands and apex catarrh. It mentions
Hmm.
about a case dates to 18th August 1881, wherein this 11 and a half year old patient had came with complaint of very bad cough at evening, and the cough used to be so bad that the patient used to perspire a lot, and the patient used to sleep, and even in sleep the patient used to cough, but the patient didn't woke up out of the cough. and it was so worse that there used to be a very bad headache at night with this cough. And this upper half of the left lung uh, had a lot of crackling and rales, which he mentioned. And later on examining, he found that there were indurated and distinctively feelable lumps or
Mm.
glands which were palpable. There is a history of vaccination scars which are present on the left arm, and the glands over the apex were present over the right side of the lung, and induration of the lymph glands on the left side of the neck, on which side the vaccination was performed. As a rule, he said ki with the side vaccination is done, that side glands should be enlarged. So this is the trouble of examining a healthy child before vaccination and after vaccination. That anytime after you can have group of symptoms, different symptoms which you have to relate to the vaccination. And for a very long time, unless cured by some medical art, he prescribed this patient with Thuja 30C and 30 potency, and which was followed by Saclab. And on August 27th, he mentions about the follow-up. The case was of 18th August, and the 27th August follow-up mentions the it is well with the cough, but the sweats used to continue now. So he further follow-up mentions of 6th of September. The chest reveals no rales at all, no cough, no sweating, and the cervical lymphatics are not being found. And the boy now weighs 5 to 8 he gained 4 lbs of weight. When the patient had come, this boy had come, it was 5 lbs. Now it has gained 8 lbs after he had received Thuja. So he mentions further his obstinate cough, uh, and this he considered it was the first stage of phthisis. Retrospectively, he looks into the case, and this boy which got this increase in weight also after Thuja, he mentions it as this is the right way of treating. Yeah, this was again a case of vaccinosis.
Yes. And the
Case number
reason
30.
yeah, in the reason number 30 mentions a case of acne on face and nose with nasal dermatitis. It's about a 20 lady, 20 years old with red pimply nose. Pimply
Mhm.
scaly nasal dermatitis existed for 6 years. Also has obstinate constipation. He gives Thuja 30. Pimples start improving. Nose is less red. Constipation is still not better. So he gives Thuja one 100 potency. Thuja in 100 potency. The face gets
Mhm.
better. The constipation is also better, and thus he writes that Thuja cured this case inconvertible.
Yeah, right. Going ahead to the
Yes,
31st
31.
case. So he mentions about a patient who is 50 years of age, and he came for this complaint of neuralgia of the right eye. And he had almost constant pain in the eye since the Christmas of 1881. And for about 6 months, he had this neuralgia, which used to radiate to the head, to the shoulder, and the doctors had almost killed him, giving him morphine injections in his shoulders again and again, to an extent that there was a time where he considered that I won't ever recover after all of this. So when he had came to Burnett, he had brown eczematous itchy patches, eruptions on both the shins and between the toes. The neuralgia of the right eye was obviously there, and both the day and night, both the time he used to have this neuralgic complaints, but more worse at night. And on inquiry, when he was last vaccinated, he seemed to be completely frightened and stammered. So he told the doctors, I should not like to get vaccinated again. He was asked why. I was very seedy at the last time and I was vaccinated. In fact, I felt awfully ill for about a month after the vaccination, and he protested that the vaccination had made him so ill from all this duration. So, uh, from this, he considered this is a vaccinal neuralgia, and he was prescribed with Thuja 30 in infrequent doses. And he mentions the further date, 8th July, but very little pain in the first powder, and so later on the cure was attempted for permanent cure of interesting proof of rapidity with which most of these remedies can cure a neuralgia. Thuja was
So reason number 32, there is a case of 26-year-old female who had ugly nails, black patches under the nails with leukorrhea, with history of chicken pox, and when she was 11 years old, and he says given Thuja, black patches disappear.
Mhm.
So reason number 33.
33. This is a bit of a longer case. We'll cut
Actually,
it short.
30, yeah, yeah, 30, actually 33 and 34. No, in 34 also he has given 10 follow-ups of that case. So I
Mhm.
think 33 and 34, if you want to skip, I think we won't mind also. Maybe you can
Okay.
just give it in short that what case is
Okay,
about
in
what.
short, I'll mention it's a case of a cataract which he has cured with medicines, and he ridicules them again. What you are saying that it's incurable and everything.
Hmm.
Over here, he mentions about a case where the case was presented as a pan-ophthalmitis for this patient, for which on examination he had this photophobia, blepharospasm, red swollen eye, for which Burnett had prescribed this patient phosphorus 1 m every hourly on the laws of similars. Later on, in 18 hours, after 18 hours of giving this phosphorus 1 m, the patient herself opened the door, was confined to a dark room. What are you reading? 50 Reasons for Being Homeopath by Burnett. Yeah. So
Somebody
18
else
hours
will
later, the
write, don't
patient
worry. कोई ना कोई
patient
लिख
herself
देगा.
opened the door, and he mentions that this photophobia had gone less, the inflammation had gone less. Later on, uh, for further treating the cataract, what the patient was actually having, the acute he treated with phosphorus, he mentions a list of remedies which he used for treating the cataract, which was asafoetida 6, potency digitalis 3, Calcarea carb 30, chelidonium 1 potency, phosphorus, sulfur, Calcarea carb, chelidonium, asafoetida digitalis, again phosphorus, sulfur 30, Calcarea carb, chelidonium, and he alternated a few medicines, asafoetida and digitalis in this case. At the end, he mentions that the cataract was cured. In the beginning of the case, he mentions that this patient had such a bad cataract that she couldn't even see the partition of her hairs in the mirror. At the end, the patient mentions that I'm able to recognize faces, I'm able to see the boards on the street, I can put my partition of my hair myself. So he also mentions that the patient who is further going to get blind, she has given us a chance, and this is how cataract was cured. He also mentions later on in further cases that there are series of remedies or ladder of remedies which can be required in certain cases to label it cured, and going some unconventional way. Yeah.
Yeah, so again, reason number 34 also, this is a case of cataract with a very, very long list of follow-ups, which he says that the patient had, they were said that there is there was no solution.
Mm-hmm.
The people said solution for cataract is only operation, no longer hope. You
Mm-hmm.
cannot, cannot see beyond for a certain age, and then you'll be blind.
Right.
And then he
Mm-hmm.
says that he starts treating this patient when sequentially he starts with sulfur, then calcarea carb
Mm-hmm.
30, and then he gives Thuja
Mm-hmm.
30, causticum 100, surinum
Mm-hmm.
100. Then he comes with
Mm-hmm.
when there was an acute episode of bad cold, he says that he's given pulsatilla 1x potency. Now the
Mm-hmm.
lens is getting milkier, then he uses Cilicia 30.
Mm-hmm.
Then Then he has no change. Again, there is causticum 30 again. Then again, no change. So he starts repeating the same potencies. And same as 3 months, this keeps going. He uses pulsatilla 1x. In October 1887, he says the vision was excellent in state. So it's a very long, long case. I think
Mm-hmm.
reason number 33, 34, and 35 also. Again, there's a case
35
of
is also
cataract.
the same.
So I think whoever is very much keen on going to the finer details, I think you should
Mm-hmm.
read these three things very in detail.
In detail. There's also a
So
book by Burnett on treating cataract.
yeah, there is a
There's a
book.
lot of cases in there.
So
So we'll go to
30,
36 directly.
36 again, there is a case of cataract in a lady of 58-year-old female where the lens
Mm-hmm.
is uniformly milky and opaque. She cannot
Mm-hmm.
read, especially these small letters. And again,
Mm-hmm.
he says that he has cured this patient. And
Right.
let's use it 37.
Right. So now reason number 37, he mentions about using multiple medicines one after another. There are certain quotes I would like to mention over here.
Yeah.
Uh, he mentions that there are certain cases, difficult, chronic, complicated cases of diseases, uh, wherein there is not one remedy required, but there are ladder or series of remedies that are required
Hmm.
to effect or bring out a cure, and
Hmm.
which altogether cumulatively acts as cure words, not a single medicine. And that is how he usually cures cataracts and other chronic diseases which are complicated ones, or they are labeled as incurable. In regarding to this, the power of utilizing long series of remedies one after another for the cure of difficult chronic cases has only in second importance to what is the law of cure itself. He originally learned this from the conversations of Dr. Drisdale, wherein he also mentions of using ladder of remedies plan. He mentions it as a course of remedies. Drisdale mentions as course of remedies is required. So he mentions a case of acute mania over here in an old age lady, wherein he mentions that he has also worked in an asylum, and having that experience, he mentions that putting such a patient in asylum will do no good to the patient. So the decision was taking that homeopathy would be used, and he was being scorned a lot by this patient's daughter and family members for taking up homeopathy. But he used baptisia in this case, and this patient never had a relapse of acute mania again. There are no any other details of baptisia why it was given, but he
Hmm.
mentions this as the 37th reason. In Burnett's
So,
works, we'll a lot of times see one remedy after another and a lot of
hmm.
succession of medicines. So that is one way. Yeah, 38.
So again, in further point number 38, also he carries it forward and he mentions a case, one patient from asylum was
Mm-hmm,
suffering from mania, and she's a very and she was in a very bad state, and doctor said there was no hope in her and has been violent for so long, feels she will never get well, and cured and required 3 to 4 people to bring her to the special carriage. Violence was very dreadful. Well, this patient also, he mentions that he has cured, and I think in this there was no remedy mentioned that how he cured this patient, but
mm-hmm,
definitely he says that this case was reported in British Journal of Homeopathy,
mm-hmm,
and even this patient saw this magical cure, and though the people who were abusing or slandering him were
mm-hmm.
ultimately apologized to Burnett at the end when this patient got better.
Right. So going ahead, 39th
39.
case. It's a very short case
Yeah.
where the patient had been to a lot of eminent physicians in London for his complaint of windy dyspepsia, a lot of gastric complaints, which used to be accompanied with constant pain in the whole of abdomen, foul flutters, lot of constant diarrhea, and involuntary diarrhea, terrible distress. These things used to cause a lot of distress to him. So he just mentioned a series of remedies which helped this patient. He used medicines like arsenicum album 5 potency, naxomica 5, sulfur 5, lycopodium 12, and colocynth 3x. Wherein this was mentioned later by this patient that these medicines somehow suit me and I'm better with this distressing dyspepsia complaints.
Now,
Yeah.
reason number
Mm,
40, there is a case of a 12-year-old girl who's
mhm,
army officer's daughter. Now she says, now she comes with a complaint that feels like something is growing in her mouth. Similar complaints was seen a year ago. After operation it has appeared again, and now she says that there is difficulty in eating. On examination, the frenulum was warty, fleshy, the
mhm,
excrescence shape of coxcomb. Normal teeth, tongue coated pale. Now he gives Thuja 30. After Thuja, growth down to the size of a pea. After the size was again, after this going down in the size, it starts growing again uh, to as much as a horse bean. So he uses here Sabina. Still, the small growth was there was there. So he says he mentions here using Cupressus lawsoniana. Now,
Mm-hmm.
this after using Cupressus lawsoniana, the patient is much better, and without any ligation or excision, the wart is absolutely melted. So let's go to reason number 41.
Yeah. In the beginning of reason 40, when he mentions about treating a case of deafness, and he asks this Dr. T.A.K., have you ever thought of curing a patient with deafness? And then he says, he ridicules him, oh, you call it incurable, like that. And what all these oral departments or the ear departments in the hospitals do is just for the namesake. They'll just do a lot of syringing and scraping and nothing else. They do, or they don't even attempt to find the reason why the patient is having deafness or something like that. So before going to that case would come to you in the next reason. He
Yeah.
mentions how this patient came to uh, Burnett. Her daughter, who was having neuralgic complaints, had came once to Burnett, and she had very bad facial neuralgia on the left side of the face, radiating to the shoulder, to the face, to the head, causing lot of distress. And this lady, 40 years of age, she received Thuja in a very high dilution, in infrequent doses, which cured her neuralgia and all the 50. So he mentions this is the 41st reason which brought her this patient which got cured, and later on he brought her mother who had this deafness complaint. So Thuja in high potency cured her neuralgia.
Yeah. So in again, the case number 40 to 44 is a case of deafness due to chronic inflammation and swelling of the walls of external meatus on both the sides. He
Mhm.
says that he has cured this case by using Thuja, Surinam sabina, and Cyanothus. The
Mm.
lady then later on becomes a homeopath herself.
So
Case number
reason number
43.
44.
43.
Dr. Viraj writes, I'm late. Okay.
Arey, he's come from his first sleep.
Yeah. So in 43rd reason, he mentions of sharing a case of a small growth which is called as Enchondroma indicus, which was cured by Calcarea floor alone. So he mentions 60-year-old lady came to him. He mentions everything with dates. The follow-ups he mentions 13th October 83, a shiny swelling on the left index finger, and had been there for almost 18 months. And the lump was very hard, very painful, and it was of a size of a small split-size walnut. That was the huge size, and the patient was very nervous and depressed because of this complaint. So he prescribed her Calcarea floor 3x potency, 6 grains daily, 4 times a day, a dry on the tongue. He mentions further follow-ups on 27th October. There is great improvement. Then he repeats the same. 3rd November. This cartilaginous nature is now clearly can be felt on examination. Then 3rd November follow-up. Then 10th November, that swelling continues to get softer. Then he gives the dry doses of the same medicine. This still progresses, and further it becomes softer and smaller on the finger, and there is an inflammatory sign which is seen. The skin feels to be hot and red, and it seems to be more swollen. He repeats the same medicine, Calcarea floor 3x. Then further follow-ups of 24th November, he mentions the tumor is softer and smaller, and the patient is now able to begin to bend her finger, which previously it was impossible. So giving further follow-ups, he goes further uh, until in a short way until New Year crosses, and by the end of December she is nearly well. So he mentions by right. He mentions that I remember by Gravol. He mentioned the first use of this medicine of Calcarea floor to be used in cases of enchondromas by Dr. Gravol, and the what is important over here in this case, it is not the size. No, he mentions the importance of the tumor. It is not only the size or half of the size of the walnut, but the fact that the only one remedy was used for the longest possible time, and no other changes were made either in diet or anything else. The lady had a hard lump for 18 months, which was cured by Calcarea floor.
So again, in the case, I think now in the reason number 44 is about mentioning that how traumatic breast tumors were
Mhm,
treated very successfully with Belispor. So he mentions here examples of a young lady who had a
mhm,
malignant growth when with on the further inquiry, he said there was a history of trauma to the breast.
mhm,
And then he further on cures with Belispor
mhm,
in low potencies. And I think in
mhm.
reason number 45 and 46 also, there
Yeah,
is a long cases with long follow-ups.
very
So I
long
think
follow-ups.
yeah, very long follow-ups. So I think we'll skip that also. So
In
45,
very short,
46.
I'll mention how medicines he changes and how fast he goes.
Yeah.
45th is a case of a tumor in the throat of a size of an egg. Earlier in the beginning, he's not sure it's from larynx or pharynx, but symptomatically he starts to treat the patient. Sulfur iod 3x, then the patient worsens, there is no change. Then he goes to soranum, soranum
Mm,
30 potency, then thuja and soranum 30. He alternates with each other till a point where after thuja, the patient starts to feel choky and there is a lot of swollen sensation.
mm,
Then Burnett goes on giving Merck which
mm,
brings it back to original size. Now the patient starts with complaints of rheumatism of the
mm,
ankle and the knee. Then after a lot of series of medicine go on, Soranum 30, then sulfur iod 3x, then Kondurango, then Thuja 30, Urea 6. After Urea 6, the aphonia complaints, and there is a lot of rheumatic complaints which again come up. After which he continues Phytolacca. The patient is better, still he continues Phytolacca. And the patient gets better. Lastly, he gives sulfur iod 30, uh, and yeah, that is how it goes. There's a lot of series of follow-ups one after another. At the end, the whole lump is completely gone, and he later on mentions that it had no origin of larynx or anything, and it got cured. It was a case of a tumor in the throat, where a
mm.
series of remedies were required. That is more important to focus on. Yeah.
Similarly, in reason number 46 also, there is a tumor in the right breast in a man where he
Mm-hmm.
starts off by examining the patient and and patient is given suriname in 30 potency. Follow up, he keeps repeating this remedy till there is new set of symptom.
Mm-hmm.
Patients then in for one of the follow-ups says constipated, tongue is thick and
Mm-hmm.
furred. So he switches to Hydrastis canadensis 3x. Then he
Mm-hmm.
changes to 6x potency. Now
Mm-hmm.
there is that sebaceous scalp with yellow scab at the middle of the sternum. He switches to Thuja 30,
Mm-hmm.
and which then he sees that tumor has started disappearing with a scaly eruption. So he comes back to Sorinum 30, reddish scaly eruption on the skin and the chest. He switches to Chelidonium 30, and then he says there is no trace in the mid and or a patch at the mid sternum. So he at the end he gives natrum sulf in 6x trituration. The tumor never returned. We have now reason number 47.
Reason number 47 is case of angina pectoris, wherein he has this patient who had this suppression of menses, and this patient was having a lot of depressive issues, and there was some loss of fortune in the history. There is a lot of fright, there is fear of loved ones. What this patient had was a very chronic on and off complaint of angina, one fine day which got very bad. There is a history of very chronic chest pain in the precordial region, running to the left breast. For years, this patient had applied pain patches and blisters, which temporarily gave relief, but the patient was left very morose, depressed, and very bad with these anginal complaints with menses suppressed. The patient was prescribed with Aurum Met 30, Aurum Met 3 potency every 4 hourly, which cured her constant pain within a week, and her anginal attacks were never recurred later on. Although the menses never appeared, he mentions that she's further under treatment for her menstrual complaints. And this is how gold can bring difference in the patient's life from a homeopathic perspective, not to mention that allopathic prescribing has nothing to do with gold as a medicine, but he mentions of the benefits. of gold as
Okay.
a medicine. Yeah.
So he further on goes to reason number 48, and even here there is a remedy of gold. This is a case
Hmm.
of dropsy in lower extremities, where his 50-year-old female feared that she was beyond recovery. Lower extremities were painful, pitted on pressure, aggravation night, better in morning. That great depression of spirits, profound melancholy, weak pulse, feeble heart, discharge from nose with blood. He mentions here using muriate of gold, that is aurum muraticum, which
Or a miracle.
rapidly cures the patient. And let's go to reason number 49.
Reason number 49 is a case of rheumatic endocarditis with the rheumatic fever, wherein in the beginning he mentions that every person has some favorite people in life, just like that. I have few favorite remedies. He mentions gold is one of my favorite remedies in treating certain pathological cases. So, a case of rheumatic endocarditis, wherein lady about 45 years was dangerously ill for a prolonged 3 weeks of rheumatic fever constantly, which was not getting better. And there are some homeopath nearby who was a layman who himself used to treat a lot of patients. He also tried, but it didn't help, and rather the case got very worsened. And then, in an alarming situation, this case came to Burnett. The rheumatism was so bad that the patient couldn't even move. The respiratory complaints, the breathing was very hurried, the lips became bluish, anxious expression on the face, puffiness under the eyes, moist trails all over the chest. Then the pulse used to be rapid, compressible, and intermittent, and loud endocardial brutes. And this was a very bad situation wherein her joints were also almost locked, like as if ankylosed, and the patient couldn't even move the feet. So in this case, he gave aurum foliatum in 2x trituration, and which was repeated very frequently. And there are no other auxiliary medicines which were given. Why aurum? He gives the reason that the effects on the heart and the respiration are very much like they affect in this patient of the proving he's saying. And moreover, it produces profuse perspiration. This case had profuse perspiration in this cardiac and respiratory complaints, profound weakness, anorexia, great anxiety, and bones were also involved. He gives the reason, and he gives follow-up of every next day. 18th February, 19th February, patient is better, patient is better. There is the patient now seems to be out of danger. And after 5 days, he mentions that the patient is quite comfortable, but now he will add natrum sulf 6 potency with aurum in alternation, because he mentions aurum pathology is there, and secondly, now natrum sulf symptoms or indications have showed up. So he alternates the medicine. Later on, the patient, after a week's follow-up, he mentions the patient is free of rheumatism, and the patient is quite comfortable. The appetite has got better. Later, he mentions that gold on the organic tissues of the heart causes these degenerative conditions, which can be life-threatening. And the case earlier, which when he took, it was of a very bad prognosis, and he later on mentions it's just not the faith in the doctor that did not cure her for the patient, but he never saw the patient later on, but the patient got better from this rheumatic endocarditis.
Okay. So the last and the final reason with
Hmm.
where we will end the session also, there's reason number 50 where he says that
Yeah.
I have previously so the reason number 49 was also of the angina pectoris. Even this is of the case of angina pectoris, which had
Hmm.
come from the which had come from after suppressed skin diseases, and he because now it was the reason number 50 and he was going to end this book.
Hmm.
So he gives it a very knocking case. He says that I have used just sulfur 30 as this remedy. Where this young lady with angina attacks while going to church. She no longer went out alone, dread of falling down with apprehension. She had dyspepsia, flatulent dyspnea, palpitations, and anginal attacks. Though there is a skin lesion which never really cured. So he thinks that it is better to treat this patient antisorically. Old cracks start reappearing in the bend of the elbows. After that, she had no further attacks of angina, and therefore he comes to the end of this book where he mentions that I will write this book. I will publish this book. Obviously, he has removed a lot of individualistic and very specific approaches or names and all the
Right.
specifications. But he goes out to
Hmm.
write that I want to publish this book for my world of homeopathy, to stay
Hmm.
there and be very confident as much as I was. And I think we too were also very confident today, because it took
To
almost
begin with
90,
this book.
yeah, yeah, to begin this with this book. And you all stayed with us during this whole session. So 90 minutes it took to read out
Hmm.
this book, very book. But it is just a glimpse of it. The whole micro details are still there in the book. I would request all of you to go back, read this book, open this book, and get the real energy of Dr. Burnett. Because from here, all the Burnett series books will also be opened. There is Cataract, there is Tumors, there is
Change in life of
spleen, there
woman.
is changing life,
Then
and
yeah,
then there is a gold wala book आएगा, फिर उसमें aurum as
yeah.
gold as a solvent. So we'll be reading a lot of Burnett. So thank you all for staying. Thank you Vansh for joining and being giving this long session justice as much as it was needed.
No, thank you so much, Abhishek bhai. Over a long period of time, we had this discussion that we'll have books reading and discussion with.
Yes, yes,
See,
yes,
almost 25, 30 people were there throughout the session. So, uh, as homeopaths, we'll always face these things that the patient is willing, family members are unwilling. We'll be criticized for so many things. All these same stories are mentioned by Burnett also. तो ये चीजें तब से चलती आ रही है, आगे भी आएगा. We have to face a lot of all these
yes.
hurdles, I'll say. But at the end of the day, there is a great satisfaction with what we are blessed to do with.
Yes. So thank you all for being there with us. Thank you, Dr. Misam. Thank you, Dr. Viraj. Shwet, thank you so much. And I thank you all of you for being there with us. And good night for today.
Yeah,
Bye bye. Take care.
at the end, we'll have just
Yeah,
two
yeah,
or
yeah.
three book
Yes, yes.
recommendations
Yes,
that I
yes.
want to say.
Give me just name of three books which you really want to recommend.
Sure. Rather than just three books, I'll just mention the authors. The works of Borland and Fobister is something which is very practically useful in practice that I'd recommend. Number one. Number two is these are two books which help in understanding Mayism. One is Picturesque by Dr. Soumendra Adhikari, which has helped me a lot. My practice has modified a lot. And the second book, Chronic Diseases by Ghatak. This book was earlier by the name of P.N. Banerjee, but it is by the name of Ghatak. These two books help a lot in understanding the miasms. And lastly, Principles and Practice of Homeopathy by Emil Dhore, specifically chapter number 3 in this book on symptomatology, 36 symptom classification, which really helps at least me understand the symptom classification in a very short time. And the 14th chapter in it about susceptibility, how you choose potency, when you repeat, when you stop, all of those things. These are 3 4 books which practically really helped me. Hope it helps you also.
Yeah. Good night. Bye
Thank
bye.
you,
Take
Dr.
care.
Abhishek.
Thank you.
Thank
Thank
you.
you
Bye.
once. Thank you. Bye bye.